Welcome back to Spotlight. I've been joined by the Coordinator for Health Promotion Services in the Ministry of Health and Social Development, Ms. Ivy George. Welcome, Ms. Ivy. Good to see you.
I'm glad to be here.
Yes, good. I'm glad you're here. Caribbean Wellness Day is coming up again.
Yes, on the 10th of September.
Yeah, and just give us a just quick snippet of what Caribbean Wellness Day signifies, and what we got a theme this year.
Yes, Caribbean Wellness Day is a very important health observance in the Caribbean. It's one of our events. It was developed, it was introduced by CARICOM, the heads of government, coming out of the 2007 National Summit on NCD. And after that summit, there was a declaration, the Port of Spain Declaration, and it has a 14-point action. And one of the action was that on the second Saturday of September, that throughout the Caribbean, we will observe what we call Caribbean Wellness Day. It's coordinated between CARICOM, the Caribbean Public Health Association, and PAHO.
Okay. And the theme this year is?
The theme this year is on children. When we first started in 2007, I think for the first couple of years we had sort of just events. Mm-hmm. And then we made a decision that we are going to work with NCD across the life cycle, meaning from children to to seniors. Mm-hmm. And so for the last 5 years, I think, each year we had a theme along that line. And we made a decision also, instead of just having one-off events and so, that we will use the Caribbean Health Promotion Charter, and we will follow a guideline and put in place activities, policies, long-term programs, etc., that will really have an impact in this particular area. And the theme this year is children in healthy environment. Mm. We also want to highlight some of the milestones that we have achieved in the BVI in terms of in the area of children. Okay. We are looking at the Baby Friendly Hospital Initiative, which is something that is put out by UNICEF. And we have started that process. We have developed a number of the training. We have had some awareness sessions and so forth with the hospital staff. We have trained some other person to carry it on. So we have to, I think there's a 6-point that we have to complete, and then we would be ready to apply for membership. They will then come and evaluate us and see if we can be classified as a baby-friendly hospital. To be classified as a baby-friendly hospital, one of the things we are promoting is during the first 6 months of a child's life, the child should be breastfed.
At least 6 months. At least 6 months. For at least 6 months.
Yes, and that they're saying that children who are breastfed, there are a number of health benefits for doing that. Mm-hmm. We have seen an increase in the number of persons that are breastfeeding in the younger generation, and so we are happy for that. So this is one thing that we have done, that we are working towards, which will be long term. Mm-hmm. We have also, with the help of the Caribbean Public Health Agency, have developed a guideline for feeding of young children. This is also something very important because, as I heard you mention earlier, 2 things to me are very, very important, and for some reason we are not paying enough attention, and that is the eating healthy and physical activity, and it must start from in childhood. So, so we have developed this guideline. We have also just received a pamphlet from CARFO, which is the Caribbean Institute, also again, which will be another tool that we'll be able to use to talk about the importance of physical activity and nutrition in young children. The other thing that we have been able to do is the Minister of Health and the Minister of Education signed a memorandum of understanding in terms of improving the academic performance and health of students. And we have introduced, so in that memorandum, there's a number of points that we will be working towards. We have established the fact that, like all other things, education will take the lead, and the Ministry of Health will support, provide the technical support, and etc.
What programs do you have in the school in that regard right now? There are some nutrition programs in the school.
Yes, we have, and coming out of that, we have established one of our subcommittees is Healthy School Committee. So the people who are taking the lead in this whole school, strengthening of school health, is the school itself, because unless the sector in which these things fall take a active and a support, a leadership role, then you are not going to be able to see the kind of impact that we need. And one of the programs that we started last year with the help of the Caribbean Public Health Agency is a project called Healthy School, and we are looking at we have introduced nutrition in terms of behavioral changes that we want them to see. The school environment, we are involving the parents. We want to do things like healthy school gardening, offer cooking classes to the students and to the parents, as well as the teachers have incorporated lessons that they will teach and they have infused in other subjects.
So have you started the children to bring healthier snacks to school yet?
Yes, they have started that, and some schools have what they call fruit and water day, which is, many of them had it for one day, but we are hoping that that will improve. And before we start the project, we did an evaluation measurement of the student. We gave them a test in terms of their knowledge. We did their blood pressure. We measured them in terms of weight and height. And we also did some physical activity. So, yes.
Were we able to get the vendors on the campus to improve their offerings and have healthier?
We are dealing with the primary school. We have spoken, we have involved the vendors. Some have been more cooperative than others. We have also spoken to the parents about the importance of giving their children more wholesome food, because there is so much research out there that shows how you can improve academic performance and health of students by introducing more wholesome food and increasing physical activity.
Okay. So are we going to get because I know the physical education classes in school I think once a week.
Once a week.
Are we going to increase in the curriculum the physical activity?
We are looking at it. We have just introduced a physical education curriculum in the primary school. The one in the high school was there before, but beginning this term, They will have a curriculum. Now we have to look very carefully at in terms of increasing the days because they're going to mean more staff, etc. The recommendation is 5 days a week. We might not be able to go to that length, so we're going to have to sit down and really carefully, but that is one of the points in CARICOM, and we have been evaluated, and that was one of the areas that we were not successful in being able to accomplish.
So now we have a strategy for the reduction and prevention of non-communicable disease. You had a conference a few months back to launch that strategy. Just tell us briefly what are some of the things that you're hoping to achieve from the strategy to prevent and reduce non-communicable chronic diseases.
As I mentioned before, one of the things that we want to strengthen school health. The whole approach to how we are dealing with health in the schools. And we have a committee that is set up, and the committee, right now we are looking at establishing what are the areas that we are going to have under school health in the BVI. And so we are looking at developing a Virgin Islands school health framework. We have done quite a bit of work so far, so it's a matter now of bringing it to the leaders to get some opinion, get the final input before it then have to go to cabinet. Okay.
Now, Wellness Day is coming up on the 10th.
The 10th.
Caribbean Wellness Day, and of course, this came out of the fact that the non-communicable chronic diseases in the region.
Yes, it's one of the highest it's one of the highest in the region. Canada, the Caribbean, South America, Central America.
And it's costing us a fortune
everywhere by all of these leaders, and so they're making a effort to work on certain things together and certain things, I guess, separately. And I must say that since the leaders have become involved in this area, there has been much improvement. We have seen some growth even at this year at the CARICOM meeting. They have made a pledge again to continue to support, and we are going to make some shift in how we are dealing with it. And next year will be a big year. It will be a 10-year anniversary since we have been started on this pathway. And so there's been quite a bit of progress, and being a part of this project has helped us. For us, as I mentioned, now we have the chronic disease strategy. We have restructured our BVI Health and Wellness Committee. First, the committee was just meeting once a year, sort of like monitoring. We have a committee now that meets every other month. The committee is more active, they're asking more questions, they're giving more assistance. So that is very good. We have developed a structure for government. We are working first with government, where we have developed a structure that will lead to institutionalization and also other sectors taking a more active role. We talk about education. We have just appointed a new leader for the healthy workforce, that is the deputy director in Labor Department, and we should be meeting this month to discuss what are the areas we are going to be tackling under that area. Under the healthy spaces and places, we are working with Outdoor Trust from the UK, and they are going to be helping us to put in place in the Rotong area a Commonwealth walkway, which will be used for jogging and walking, etc. So that should be happening in November. Under The hospital, we have completed a 3-year action plan, and so we are just waiting for the primary care section of the Health Service Authority to roll out this plan, which would look at chronic, on special emphasis on diabetes and high blood pressure, because these two areas are very much out of control. We have also been able to be a part of the Stanford University Chronic Care Self-Management Project. We have trained 14 persons, and people have not taken, we had to set up some programs the other day, but we didn't have very good results, so we are going at it again. And I really want to encourage persons who have a chronic disease. Chronic disease is not like when you have an acute infection or something. You go to the doctor gives you some medication, and it will go away. A chronic disease will be with you for a very long time. And so therefore, and it is your responsibility to manage that disease. You work with your physician, but you cannot leave it up to the health care people to do most of the work. And this is what is happening. A lot of our patients are not taking the kind of responsibility for their health that they need to, and that is why we are seeing so many persons using the dialysis machine, amputation, blindness, strokes, a lot of the cancers and stuff like that. If people would be more involved, and in the terms of prevention, even in terms that if you have the disease, manage it in such a way that you could still live a healthy life. And so I'm saying that it is well established that chronic disease you can prevent, they can be delayed, and if you have a disease, that you can still live a healthy life if you do certain things.
You have to manage it and take responsibility for making sure
and
that
and this course that is going to be offered, it's 6 sessions. And some people say, 6 sessions, I thought it was going to be 1, but we are talking here about behavior change. We are not talking about information, and it takes about that amount of time to bring about behavior change.
Okay. The few minutes we have remaining,
Yes.
let's talk about activities for Wellness Day.
Well, 2 sectors will be observing activity this year. Through the workforce, we will be doing a fun walk run, which will take place on the 9th. It's a workforce activity, so the idea is that we want employers to give the employee of the time, so it normally starts around 4 o'clock, and it will start at the bandstand, but there will be someone who will come next week, I think, to promote more that activity. The second sector that will be doing activities this year would be the schools. We have 14 primary schools, and we have health liaison teacher in each school. So the health liaison teacher in each school work with the rest of the staff, and they will decide an activity that they will do for the school to promote Caribbean Wellness Day. In the past, we also used to have a community path, but we have not had it. But I'm sending out the word from now that next year is our 10th anniversary, and we definitely would like to see the community back in swings.
Okay. And of course,
other activities, those are the short-term activities. We will have a message from our new chair, which is Mr. Elton Georges. We'll also have the message from the executive director from CAFA, and we'll also want to get a message from a senior person in education, since we are dealing with children. But we also have some long-term activities, which would be like, for example, we want to deal with the daycare and the preschools to set up some guidelines for food and nutrition for feeding and also for physical activity. So that is one of the activities that we want to look at. We also want to, we also want to, coming out of the data we collect from the school last year, we are now going through that data and we are finding some areas, obesity, overweight, and underweight. So that is an area that we will need to make some special intervention with, working with the Health Services Authority. So that will also be a long term. The other area is the physical activity. And in September, through the BVI Olympic Committee, we will have a workshop on physical literacy. And coming out of that workshop, we want to really begin to promote the whole concept about preparing children in primary school and in the daycare and the preschool, because you have to set that foundation if we are going to be able to do two things: continue to be healthy in our adults and also have more people to have a chance to become elite athletes. So those are some of the things that we are working on this year.
All right. So next week we could look forward to more discussion about the Wellness Day activities and get more details.
And the workforce. That will be the activity that the coordinator for that project, and that comes under our physical fitness, physical activity, and physical literacy subcommittee, which is associated with the Department of Sports and Youth Affairs.
Okay, and of course that means learning about exercise and the activities you need to do in order to keep you physically fit.
Yes, that committee looks at the adult part of it, trying to increase physical activity in the adult, and the other part for the students and children comes under education, because they are the ones who deal mostly with the preschool, the daycare, and students.
Okay.
Yes.
Well, Ivy, thank you for stopping by.
Thank you for having us.
It's a pleasure, and it seems like you're moving full speed ahead with the prevention aspect of our health and maintaining our wellness in order to reduce the cost of illness in the country. So it seems like you're doing a great job.
Thank you very much, and I just want to thank all the people who are helping in any way, whatever the way they are helping to serve on committees, to be advisors, whatever people are doing to help us to get this word out, to help us with policies, with projects. I want to say a big, big thank you. Without the support of the people, we would not have been able to make it this far. I know for some people they might think we are not going as fast as we can, but we are building a foundation because we are going somewhere. And I just want to remind you that health is too important issue to just leave it up to the Ministry of Health. So we need your support. So I'm looking forward to that. And it's my pleasure to serve.
Thank you, Mide. We're going to take a break for a word from our sponsors, and when we come back, we're going to be joined by Commissioner Michael Matthews, and we're going to talk about his road safety initiative and his visions and goals for law enforcement here in the territory. Don't go away. We'll be right back after these words from our sponsors.
Spotlight is brought to you by Tortola Concrete Limited and CTL Home Center, the best products for the lowest prices, period.